Elizabeth Ciordia, and it's July 26, 2024, and we are currently in week 4 doing our video lab presentation, and it's on a chicken wing dissection. I have my wing here. I'm going to go ahead and start naming some of the parts. So this thicker bone here is the humerus, and then this top part right up here would be the head of our humerus, and then our shoulder joint would be here. Then if we go down to this joint here, that would be our elbow joint. And then we have the joint of the capsule here. It's a white substance in between. And then this sleek coating right here on this area, which is like it looks like a hard white substance. It almost resembles like a tooth, I would say, but it's like a sleek coating. That would be the articular cartilage. And then surrounding this area is where we have the synovial membrane right around here. And then in between we have the synovial fluid. It acts as a lubricant for our joints because there's just so much friction in this joint. For example, we're constantly moving it, and it just helps lubricate that area. And then if we move on to these bones, this smaller, thinner bone here is the radius, and then this thicker, bigger bone would be the ulna. And then this white, like shiny, stretchy material here would be our tendon. It almost looks like a pearl color, so you can't really miss it. It's really shiny. And then the disease that I chose to discuss today is gout. It's a form of arthritis. It causes some symptoms such as swelling, severe pain in the joint, and redness. And the reason that gout happens is because these uric crystals start to form, and then the crystals get deposited into your joints. And then that's when you start experiencing those pains, the pain and the symptoms that I mentioned. And usually the pain is pretty severe. And the reason these crystals are formed is because the uric acid levels in your blood tend to get high and become elevated. And then that's what in turn causes the crystals to form. It's most commonly seen in the feet, especially the big toe, but it can happen to other joints as well. It's just most commonly in that area. And some of the treatments that are recommended would be like anti-inflammatory medications, corticosteroids. Colchicine is one of the ones that they prescribe often. And then also some restrictions are recommended. For example, some dietary restrictions. Alcohol intake needs to be limited, as well as a low purine diet. So an example of one of the limitations would be like red meat. And then also lifestyle changes are recommended, such as a weight loss and exercise. Thank you.